Imagine waking up feeling refreshed, with great digestion and radiant skin. What if I told you that a simple ingredient in your kitchen could do all that? Want to know how? Let's go! Like and subscribe to our channel. Each like and subscription helps us bring you more quality health content. Your participation makes the difference. Apple cider vinegar has been celebrated for centuries for its supposed healing properties, gaining prominence in various cultures worldwide as a versatile home remedy. Originating from the fermentation of apple juice, this acidic liquid has been used since ancient times, with records of its use by Hippocrates, the father of modern medicine, who prescribed it as a healing elixir for a variety of ailments. Over the centuries, apple cider vinegar has been employed in traditional medical practices for everything from wound treatment to digestive issues, solidifying its reputation as an accessible and multifaceted solution in folk medicine. Chemically, apple cider vinegar is notable for its rich mix of vital components. It contains essential nutrients, including B vitamins, vitamin C, and minerals like potassium and magnesium, which are crucial for overall health maintenance. Additionally, the presence of acetic acid, the primary active component, is responsible for many of its therapeutic properties. Acetic acid contributes to the vinegar's antimicrobial characteristics and plays a key role in regulating blood glucose levels, making apple cider vinegar a popular choice for those seeking a natural approach to health management. Apple cider vinegar has been associated with various health benefits, including the ability to positively influence sleep quality, a connection that may seem surprising at first glance. Scientifically, one reason for this influence is the presence of acetic acid, which has the potential to moderate blood sugar levels throughout the night. Maintaining stable blood glucose levels is crucial to prevent sleep interruptions caused by spikes and drops, which can wake a person unexpectedly. Additionally, apple cider vinegar contains amino acids that combat fatigue, helping the body break down and use lactic acid more effectively, promoting deeper relaxation during the night. Furthermore, apple cider vinegar is rich in vitamins and minerals, like potassium, which are essential for maintaining a healthy sleep cycle. Potassium helps regulate blood pressure and relax muscles, factors that contribute to a smoother induction into sleep and uninterrupted nighttime rest. Ingesting diluted apple cider vinegar before bed can therefore help prepare the body for a restful night, reducing the time needed to fall asleep and enhancing overall sleep quality. However, it is important to note that consumption should be moderate and accompanied by consistent sleep hygiene habits to maximize the benefits. Benefit 1. Improved nighttime digestion. Apple cider vinegar is recognized for its digestive aid properties, making it a popular choice for those seeking natural solutions for digestive problems, including nighttime discomfort. The vinegar's ability to enhance digestion can be primarily attributed to acetic acid, which stimulates stomach acid production. This additional acidity helps the stomach break down proteins and other foods more effectively, reducing the risk of indigestion and bloating, common when the body struggles to process evening meals. Additionally, apple cider vinegar can help regulate stomach movements and gastric emptying, contributing to more stable digestion and preventing acid reflux. When the stomach takes too long to empty, its contents can back up into the esophagus, causing discomfort and heartburn. By speeding up the gastric emptying process, apple cider vinegar helps prevent stomach acid from rising, providing a more peaceful night's sleep free from gastric discomfort. Finally, using apple cider vinegar as part of a nighttime routine can benefit gut flora, promoting the growth of beneficial bacteria and improving overall digestive tract health. This is crucial for effective digestion and can also reduce the incidence of acid reflux. By maintaining a balanced diet and incorporating a moderate amount of diluted apple cider vinegar before bed, many find relief from chronic digestive problems and significantly improve their nighttime quality of life. Benefit 2. Blood sugar control. Apple cider vinegar has been studied for its properties that can positively influence glycemic control, making it an interesting addition to the diet of people with type 2 diabetes. One of the most impactful ways apple cider vinegar aids in this control is by improving insulin sensitivity. Studies indicate that consuming apple cider vinegar can improve insulin sensitivity by up to 34% during a high-carb meal. This improvement allows the body to process glucose better, reducing dangerous blood sugar spikes for diabetics. Additionally, apple cider vinegar can help slow gastric emptying, which is beneficial for people with type 2 diabetes because delayed digestion can prevent rapid spikes in blood sugar levels after meals. By moderating the rate at which food is released from the stomach into the intestine, where sugars are absorbed, apple cider vinegar can provide a more gradual and controlled rise in blood glucose, avoiding the spikes that can occur after a carb-rich meal. Finally, the acetic acid in apple cider vinegar also plays a role in glucose metabolism. It is believed that this acid interacts with certain enzymes that break down carbohydrates, including amylase, limiting the amount of glucose absorbed into the bloodstream. For this reason, regular consumption of apple cider vinegar, especially before meals, can be an effective strategy for maintaining more stable blood glucose levels, which is essential for managing type 2 diabetes. Benefit 3. Weight loss potential. Apple cider vinegar has attracted attention for its potential weight loss properties, with several studies supporting the idea that regular consumption can help promote a greater feeling of satiety. This characteristic is attributed to the presence of acetic acid, which can influence the brain's satiety center. When consumed as part of a meal, apple cider vinegar can help reduce the speed at which the stomach empties its contents into the small intestine, prolonging the feeling of fullness and reducing the total calorie intake throughout the day. This is particularly useful for those trying to control food intake in a weight loss diet. In addition to increasing satiety, apple cider vinegar is also considered a catalyst for metabolism. Studies suggest that acetic acid may have a thermogenic role, increasing the rate at which the body burns calories. This occurs by promoting the oxidation of fatty acids, meaning the body uses more fat as an energy source, thus accelerating weight loss. Furthermore, there is evidence that apple cider vinegar can interfere with the expression of genes related to fat storage, encouraging the body to store less fat and use it more efficiently as fuel. Another relevant aspect is the impact of apple cider vinegar on blood sugar and insulin levels. By helping to regulate these levels, apple cider vinegar can prevent excessive fat storage, facilitating a more favorable metabolic environment for weight loss. Combining glycemic control, reduced calorie intake, and improved fat metabolism, apple cider vinegar presents itself as a valuable aid for those looking to lose weight in a healthy and sustainable way. Benefit 4. Antimicrobial properties. Apple cider vinegar is widely recognized for its antimicrobial properties, primarily attributed to the presence of acetic acid, a compound known for its ability to inhibit the growth of bacteria and fungi. This characteristic makes apple cider vinegar a valuable ally in preventing infections and strengthening the body's natural defenses. Acetic acid has shown efficacy against various pathogenic strains, contributing to the reduction of microbial load that can cause diseases. Additionally, the acidic environment created by apple cider vinegar makes it difficult for many harmful microorganisms to survive and reproduce, thus promoting an overall improved state of health. In oral health, apple cider vinegar can be particularly beneficial. Using diluted vinegar as a mouthwash helps kill bacteria in the mouth, reducing the risk of cavities and gum disease. However, due to its acidity, apple cider vinegar should be used with caution to avoid enamel erosion. It is recommended to always dilute the vinegar adequately and limit its use to a few times a week, followed by rinsing with water to minimize potential corrosive effects on teeth while enjoying its antimicrobial properties. Besides its application in oral health, apple cider vinegar can also be used externally to treat and prevent skin infections, such as acne. Its antimicrobial action helps clear pores, reducing the presence of bacteria that cause acne and other pathogens. This topical application should also be cautious, always diluting the vinegar to avoid irritation or damage to sensitive skin. With correct use, apple cider vinegar can be an effective complement to personal hygiene practices, helping to maintain both oral and dermal health. Benefit 5. Skin health improvement. Apple cider vinegar has been used both internally and externally as an effective treatment for various skin conditions due to its antimicrobial and anti-inflammatory properties. Internally, Regular consumption of apple cider vinegar can help balance the body's pH levels, which is beneficial for skin health. A balanced pH can help reduce the incidence of eczema and other inflammatory skin conditions. Additionally, the antioxidants present in vinegar, such as vitamin C and vitamin E, can combat free radicals, helping prevent premature aging and improving the overall appearance of the skin. Externally, apple cider vinegar can be applied directly to the skin in an appropriate dilution, acting as a natural toner that helps cleanse the skin and close pores. Its acidic nature helps regulate oil production, reducing greasiness and lowering the likelihood of acne and other skin outbreaks. Moreover, the acetic acid in its composition helps restore the skin's natural acidity, promoting a more effective protective barrier against bacteria and external pollutants. However, it is crucial to perform a patch test before applying apple cider vinegar to larger areas, ensuring no adverse reactions. In addition to treating existing skin problems, apple cider vinegar can be used preventively to maintain healthy and vibrant skin. Regular inclusion of apple cider vinegar in skincare routines, whether through consumption or topical use, can provide continuous improvement in skin texture and tone. Apple cider vinegar also helps treat and prevent fungal and bacterial infections thanks to its antimicrobial properties, making it a versatile addition to any skincare regimen. Consuming apple cider vinegar before bedtime can offer several health benefits, but it's essential to follow specific guidelines to ensure its safe and effective use. Firstly, it's important to adequately dilute apple cider vinegar to avoid irritation in the esophagus and stomach caused by its acidity. The recommended ratio is 1 to 2 tablespoons of apple cider vinegar in a large glass of water. This dilution helps minimize the risk of damage to the soft tissue of the digestive tract, while allowing you to reap the desired benefits without discomfort. Additionally, it is advisable to consume the diluted apple cider vinegar about 30 minutes before bed. This gives enough time for the vinegar to work in your system without disrupting your sleep, especially if you have issues with acid reflux or indigestion. It's also important to observe how your body reacts to apple cider vinegar in the first few days of use. Start with a smaller dose, such as 1 teaspoon, and gradually increase to the recommended dose, noting any signs of digestive discomfort or other adverse effects. Finally, while apple cider vinegar is generally safe for many people, those with sensitive health conditions like stomach ulcers, gastritis, or esophagitis should consult a doctor before incorporating apple cider vinegar into their nighttime routine. Additionally, due to its acidic nature, apple cider vinegar can potentially interact with certain medications or supplements. Therefore, it's prudent to discuss its use with a healthcare professional, ensuring that apple cider vinegar is a safe and beneficial addition to your health routine. Despite the numerous health benefits of apple cider vinegar, it's important to be aware of its possible side effects, especially if consumed in excess or improperly. One of the most common side effects is the erosion of tooth enamel due to the vinegar's high acidity. To minimize this risk, it is recommended to consume diluted apple cider vinegar and use a straw to avoid direct contact with the teeth. Additionally, rinsing your mouth with water after consumption can help neutralize the acids and protect dental health. Another side effect includes irritation of the digestive tract, which can manifest as heartburn or gastric discomfort, particularly in individuals with a history of gastrointestinal problems. Beyond local effects, apple cider vinegar can also interact with certain medications, particularly diuretics, laxatives, diabetes medications, and heart medications. These interactions can alter potassium levels in the body and affect the response to medications. For example, apple cider vinegar can enhance the action of hypoglycemic drugs, leading to a dangerous drop in blood glucose levels. Therefore, it is crucial for people undergoing treatment for chronic conditions to consult a healthcare professional before starting the consumption of apple cider vinegar to ensure there are no contraindications or the need for medication adjustments. Finally, it is essential to adopt a cautious approach when introducing apple cider vinegar into the diet, starting with small doses and observing the body's response. Individuals with sensitive conditions such as peptic ulcers, esophagitis, or gastritis should be particularly careful, as apple cider vinegar can exacerbate these problems. Moderation is key, and any therapeutic use of vinegar should be accompanied by a medical consultation, ensuring that the use of this natural remedy is both safe and beneficial. Pregnant and breastfeeding women should exercise caution when considering the use of apple cider vinegar as part of their diet. Although apple cider vinegar is generally considered safe in moderate amounts, the changes in the body during pregnancy and breastfeeding can alter how certain foods and substances are tolerated. Moreover, due to the lack of robust studies on the effects of apple cider vinegar during these critical periods, it is advisable for pregnant and breastfeeding women to consult a doctor before including apple cider vinegar in their routine. This ensures that there are no inadvertent risks to the baby's development or the mother's health, especially in cases of excessive intake that could alter the body's acid balance. People with specific medical conditions, such as diabetes, stomach ulcers, or kidney disease, should also consider medical consultations before starting the consumption of apple cider vinegar. Due to its ability to alter insulin and glucose levels, apple cider vinegar may require adjustments to diabetes medications. Similarly, the acidic nature of vinegar can worsen conditions like gastritis, ulcers, or other gastrointestinal complications. Patients with kidney disease need to be cautious, as changes in electrolyte balance, such as potassium, can occur with frequent consumption of apple cider vinegar, potentially adversely affecting their condition. For those who cannot or prefer not to consume apple cider vinegar, there are several natural alternatives that can offer similar health benefits. A common substitute is lemon juice, which is also rich in citric acid and has antimicrobial and antioxidant properties. Lemon juice can help stimulate digestion, balance the body's pH, and provide a good dose of vitamin C, contributing to skin health and the immune system. It can be used similarly to apple cider vinegar, diluted in water and consumed before meals or throughout the day. Another option is red wine vinegar or white wine vinegar, which share some of the properties of apple cider vinegar due to the presence of acetic acid. These vinegars also offer digestive benefits and can help control blood sugar levels. Additionally, red wine vinegar contains resveratrol, a powerful antioxidant associated with cardiovascular health. These vinegars can be used in salads, marinades, or diluted in water for daily consumption. For those who prefer to avoid acidic vinegars and juices, ginger can be an excellent alternative. Known for its anti-inflammatory and digestive properties, ginger can help relieve nausea, improve digestion, and even contribute to blood glucose control. Ginger can be consumed as a tea, added to juices, or used as a spice in various recipes. Additionally, its thermogenic action can help speed up metabolism and promote weight loss, offering a wide range of health benefits. Apple cider vinegar offers a variety of health benefits that can be especially useful when consumed before bed. One of the main benefits is improved nighttime digestion, where apple cider vinegar helps stimulate stomach acid production, facilitating food breakdown and reducing the incidence of acid reflux. This action not only promotes more efficient digestion, but also contributes to a more peaceful and uninterrupted sleep. Another significant benefit is the positive impact on blood sugar control, particularly relevant for people with type 2 diabetes. Apple cider vinegar can improve insulin sensitivity and moderate the release of glucose into the blood, helping to prevent glucose spikes after meals. This glycemic control is crucial for maintaining stable energy levels and preventing complications associated with diabetes. Additionally, apple cider vinegar has antimicrobial properties that can benefit both oral health and skin health. Its use can help reduce the presence of harmful bacteria in the mouth, prevent cavities, and improve oral hygiene. For the skin, both topical application and internal consumption can combat infections, reduce acne, and promote healthier and more balanced skin. These benefits, along with the potential to aid weight loss and improve sleep quality, make apple cider vinegar a valuable addition to a daily health routine. In conclusion, apple cider vinegar can be a valuable addition to your health routine, offering benefits such as improved nighttime digestion, blood sugar control, weight loss support, antimicrobial properties, and promoting healthy skin. However, it is essential to use it in moderation and appropriately, always diluting it in water to avoid irritation or damage to the digestive tract and teeth. Incorporating apple cider vinegar into your nighttime routine can provide significant improvements in health and well-being, but it should be done with caution and awareness of potential side effects. Before starting any new health regimen, including the regular use of apple cider vinegar, it is highly recommended to consult a doctor or healthcare professional. This is especially important for pregnant women, breastfeeding mothers, people with specific medical conditions, or those taking medications that may interact with apple cider vinegar. Consulting with a healthcare professional will ensure that you reap the desired benefits safely and effectively, adapting the use of apple cider vinegar to your individual needs and avoiding potential health risks. So, what are you waiting for to experience the benefits of apple cider vinegar in your nighttime routine? Have you thought about how small changes can transform your health? Leave your questions or experiences with apple cider vinegar in the comments. And don't forget to subscribe to the channel and hit the bell icon so you don't miss our next health and wellness tips. See you next time.